I'm Julie Zenner along with Dennis Anderson, and here's what's coming up on Almanac North.
How do federally qualified community health centers factor into the national health care debate, and why are they important? We will talk to some community health center CEOs tonight.
The Minnesota Public Utilities Commission has approved an environmental impact statement for Enbridge's proposed Line 3 pipeline replacement, but that has not ended the dispute over the project.
And a local theater group is staging a groundbreaking performance of the play Fences with an all-black cast.
These stories, the business news, and more coming up on Almanac North. Hello and welcome to Almanac North. Thanks for watching. Denny, it's good to be back after a couple of weeks away during our March membership drive, which was very successful.
Yes, it was very successful. We'd be remiss if we didn't thank our audience, too, for supporting us and calling in your pledges of support during the membership drive.
That's right. Even went above the goals, so good job, everyone.
Yeah, thank you very much.
And there's plenty of news this week, so let's get to our first topic.
All right, Julie, thank you so very much and welcome, everyone. Community health centers play an important role in the healthcare field. Now, these federally qualified facilities provide critical services to the underinsured and those without insurance, and they have become a focal point in the national healthcare debate. Here to provide some perspective on these centers is Sally Trnka, the Executive Director of Breakwater Health Network. Kristi Halvarson is Executive Director at Community Health Service, Inc., and Dayle Patterson is the CEO of Lake Superior Community Health Service. I want to thank all three of you for being here tonight. Thank you so much for coming in on a Friday. Sally, first of all, let's maybe start with you. What is a community health service center? What do you do?
So federally qualified health centers are a program that was designated about 51 years ago to support the safety net patients across our community. So the uninsured, the underinsured, and the underserviced. Federally qualified health centers are challenged with providing full comprehensive care for the patients that they serve, so mental health, primary care services, and dental health services, all on a sliding fee scale. One of the other pieces that I think makes federally qualified health centers really unique is that it's federally required that at least 51% of their board members be made up of patients. So patients are actively involved and engaged in the strategic, financial, and operational decisions that are made at the clinic.
So if somebody comes to one of the centers for health care, if they can't pay for services, it is federally funded?
It is. There's a nominal copay, but there's also ways that can be handled. And Dayle and Kristi can speak to this as CEOs of federally qualified health centers. But it's a safety net center for anyone who doesn't have access to care elsewhere.
Now, federally qualified health centers, is that the same thing as a community health center, or is one always necessarily the other?
They're generally used interchangeably. There are some separate distinctions. So there's community health centers, there's migrant health centers, there's health centers for the homeless, and those all have technically different funding pots, but they all fall under the umbrella of federally qualified health centers.
And they all really focus on community health, am I right?
Right. So we're not allowed to turn anyone away based on their inability to pay. And it really is, those federal funds are used to subsidize the sliding fee services that we offer to all of our patients.
So why were they established in the first place?
Well, it was actually started under the Office of Economic Opportunity back in the Johnson administration. So there's a gentleman by the name of Dr. Jack Geiger, and he really was in Boston and in Mountain Bayou, Mississippi. And they realized that there was a need to keep their workforce healthy and to give people an opportunity to have access to food and medicine. So they kind of started this model based on what he had seen in South Africa. And it was put into legislation about 50 years ago since then.
Dayle, does community health look different in every community? Is there some flexibility to really customize what the program is in these?
Yeah, that's a good point. There are some commonalities among community health centers. We're all here to meet the needs of our particular community, and those might be different. So Kristi's Community Health Center, for example, they have a strong migrant worker emphasis, and they do a lot of work around sexual and intimate partner violence. Whereas here in Duluth, we have more what you might consider sort of more traditional, you come to us services, where in our buildings we're going to have medical and dental services, and in Superior we're going to also have behavioral health and substance abuse. And you'll see that if there are communities where the community health center is the only clinic in town. There are other areas like in Duluth where we are in a medically rich area where we serve a particular niche. As Kristi said, there are community health centers that serve primarily the homeless, some migrant farm workers, some with individuals with HIV/AIDS. But the commonality is that we're all here to serve the underserved and to meet community needs.
So, Kristi, what kind of services then are provided at Community Health Services?
So we're based in Moorhead, and we have clinics throughout the state of Minnesota and one in Grafton, North Dakota as well. So we do the medical services. We don't get into as much with the dental and behavioral health services as some clinics. What's unique about us, as Dayle mentioned, was some of the sexual and intimate partner violence. So we have a domestic violence advocacy program that helps with some legal services, orders for protection, hotel, motel assistance, relocation assistance, things like that. We also focus a lot on enabling services, so really meeting the patient wherever that might be, if it's getting them food bank referrals, if it's insurance with MNsure, and sometimes it's actually physically going to where they are. So we have 2 mobile units, one on either end of our service area. That's an RV that we fitted with an exam table, and we will go to churches or local restaurants or community centers with a physician or a provider to give them services right where those patients live.
So does each center then have a physician?
Yeah, each health center kind of has its own makeup. So we use a lot of mid-levels or nurse practitioners and physician assistants, but our Rochester location has primarily physicians. So there's a saying that if you've seen one community health center, you've seen one community health center.
Oh.
I think that's really the case.
Sally, what are some of the barriers to healthcare in our region that really make these community health centers an important part of just the healthcare landscape in our region?
Sure. Well, I think certainly we would be remiss if we didn't talk about how St. Louis County and Carleton County are seeing the 2 largest prevalence of death from opioid overdoses.
Sure.
So Lake Superior Community Health Center, for example, has a very robust, a newly stood up but very robust substance abuse program and mental health services that really helps. I think the misconception that everyone is insured since the passage of the Affordable Care Act creates an additional responsibility and additional opportunity for federally qualified health centers to see patients who are uninsured, but more and more we see patients who are underinsured. So with $5,000, $10,000 deductibles that they'll never meet. And so if they're able to go and receive primary care services, oral health services, which some emergency departments see roughly 40% of the patients that come into the ED are coming in for oral health needs. And a lot of dental providers don't take medical assistance. And so places like Lake Superior Community Health Center are one of the only places in the community where folks can go with Medicaid in order to receive dental health services, which we know truly is the gateway to health for everyone's body. So they really do serve an incredible niche. You know, we see great options for community health centers that are providing unique services for LGBTQ populations. As Dayle mentioned earlier, you know, really part of having a community board is that you're really being represented and responsive to the communities that you serve, which is why when you've seen one community health center, you've seen one community health center.
So are there laboratory services in each of these health centers too?
Mm-hmm.
Yes.
And so you typically, you do your own diagnostics, and then you can get back to the patient as quickly as possible. Email friendly or online friendly?
Yep, we all have patient portals, at least those of us that are members of the Breakwater Health Network. We share an electronic medical records platform. We have our own patient databases, but patients have access to the patient portal if they want to send secure messages, if they want to check their lab results, schedule appointments, things like that. They can do that online if they choose. We do some of our labs in-house right away, and then we use a reference lab so those results come automatically into the chart.
Right, and we do the same.
And there's a lot of great partnerships that have happened, especially in the rural communities, between federally qualified health centers and critical access hospitals, where there are interfaces that are built between the 2 organizations so test results can go back and forth, especially with diagnostic imaging, which most clinics don't do. And we also see partnerships in those communities where the clinic might not have a lab, but the hospital does. And so we see a lot of great partnerships happening.
Is there a great difference in rural health care as compared to maybe how it's structured in more urban settings?
That's a really great question. Yeah, I would say absolutely. So we know historically that rural patients tend to be older and they tend to be sicker. So we're seeing a lot of comorbidities, and we see a lot of patients who have much more complex healthcare needs. Exacerbating that is the lack of transportation across the districts. There are no taxi cabs, there are no buses, and a lot of these folks are poorer, so they might not have their own transportation. One of the other pieces that continues to be a challenge too in rural Minnesota are broadband, a lack of sufficient broadband, and so they might not have cell phone service. They don't have access to ambulances, for example, a lot of times. So that just makes the case for primary care even stronger.
And one other thing is that what we're starting to see is that there's some research coming out showing that loneliness is actually a really important factor in health, and depending upon just how remote someone might be living, the loneliness factor actually can play a really big part in health. And as do some of the remaining stigmas around seeking help for substance abuse treatment or for mental health treatment, particularly for people living in smaller communities who are concerned about what happens if their neighbors find out, for example.
Dayle, what about finding people to work in community health centers? Is it difficult to recruit medical professionals to work in this kind of a facility?
I think there's just a general shortage across the entire sector, regardless of who's recruiting. But one of the things that we see is that the people who come to work for us almost always are there because they have a specific passion and a specific heart for working with people in community health. They have a passion to serve, and they're there because they love community health, and that's where they want to be there. But there's definitely workforce shortages in some particular areas, particularly with dentists. As Sally mentioned, very few dentists will accept Medicaid patients, and so there's already a shortage of dentists across the United States, so trying to find dentists to come into community health can be sometimes somewhat difficult. And also there's an explosion of need in behavioral health and substance abuse, and the number of students who are coming out of school and the availability is not yet keeping up with that need. So we're all scrambling to find the folks we need.
Is there psychiatric care too?
We don't offer psychiatric care. There is psychiatric care in the community. There are other community health centers that do offer psychiatric care. And a lot of them are using mid-level psychiatric nurse practitioners to do a lot of the medication management of psychotropic medications.
Kristi, for people who may be watching who do not have health insurance, what's the benefit of coming to a facility like yours?
Well, I think the affordability is the major factor. So for about 70% of our patients fall at the lowest end of our sliding fee scale. And for them, it's a $20 visit. So that covers their office visit with the practitioner, and it covers any labs that are done that day. So I think that's a huge difference. For our population, that's migrant and seasonal farm workers primarily. We're 80% Hispanic. 70% of our patients need languages or services in another language. They're willing to drive 40 or 60 miles just to have someone that looks like them and speaks like they do. We have families that have been coming to us for generations, and some of our staff has even been farm workers themselves, so they really understand what it's like to be in that situation. And I think that's really important for patients to be able to identify with someone with them, especially for something such so personal as healthcare.
Sally, if there's one thing that you would want people who are watching tonight to come away from this conversation remembering, what would it be?
It's a great question. You know, the healthcare landscape is so incredibly complicated.
Sure.
And it's really difficult to navigate. One of the great programs that community health centers offer are navigators. So if you don't know where to start at a community health center.
Okay. Sally, Kristi, Dayle, thank you so very much for coming in tonight and telling the story.
Thanks for having us.
Thanks for having
Thank you
us.
kindly.
Thank you. Last week, the Minnesota Public Utilities Commission approved the environmental impact statement on the proposed Enbridge Line 3 pipeline replacement. The issue now moves to an administrative law judge who will make a recommendation on 2 permit requests, one on the need and one on the route. The pipeline remains a source of controversy in northern Minnesota. Here's a report from our friends at Twin Cities PBS.
On On a recent Sunday, dozens of people gathered in Grand Rapids, Minnesota, to dine on plates of smoked whitefish and traditional vegetable soup. But it wasn't just to appreciate indigenous cuisine. The event was to draw attention to the 27th anniversary of the state's largest oil spill, right here in Grand Rapids, where 1.7 million gallons of oil spilled from a ruptured line. Winona LeDuc of the nonprofit Honor the Earth is now fighting a new pipeline.
The process has been entirely flawed.
LeDuc is talking about the state permit process over a proposal by Canadian pipeline company Enbridge. It's trying to reroute an existing line through the heart of the state's lake country and Mississippi headwaters. LeDuc says it's one of the most pristine and environmentally vulnerable areas of the state.
This is the only place in the world where you can still drink the water from a lake. You know exactly what I'm saying. This is the only place where you can get like sugar from a maple, and you can have wild rice in abundance on all these lakes. And every year in succession that wild rice comes, and if you start messing with that, you lose it. And we've already got enough oil in our water. We don't need any more.
Enbridge's plan is part of a Canada to U.S. pipeline replacement project that would span more than 1,000 miles. In Minnesota, the Line 3 project will cost $2.6 billion and would go from the border to Clearbrook Station, northwest of Bemidji, then south to Park Rapids, and east to Superior. The line's manager, Paul Ebarth, met us at the terminal.
Well, we're looking at the Clearbrook terminal, and here Enbridge has a connection to the main pipelines that feed the Twin Cities refinery. So oil comes out of our pipelines at this terminal and gets fed into the Minnesota pipeline system, which brings the oil down to the Twin Cities refineries.
2.8 million barrels of oil flows into Clearbrook each day. About 390,000 barrels of it comes in on Line 3. Right now, the line is only running at half volume because of safety concerns. Ebarth says the pipe is wearing down.
It was built in the 60s, and when Line 3 was built, the type of coating that was put on the pipeline to protect it from the elements that might lead to corrosion was a polycon tape. So a plastic tape was wrapped around the pipeline. And over time that has pulled away from the steel. It's allowed the infiltration of water and elements to accelerate the rate of corrosion on the steel.
So you've had to do a lot more maintenance in recent years?
We have, that's right. Line 3 has had to be maintained and repaired much more frequently recently than our other pipelines.
Like this project, replacing pipes along U.S. Highway 2. Ebarth says a new route will increase capacity to 760,000 barrels a day. New technology means better, safer pipes. And by using another route instead of replacing in the same corridor, the oil supply won't be interrupted. And the new pipes will be bigger. Ebarth says more capacity means more oil for everyone.
Our system cannot move what is being asked by our shippers, so all shippers are only getting a portion of the crude oil supply they're asking for, which includes the Minnesota refineries.
The upgrades to Line 3 are part of a settlement with the EPA. Enbridge has to replace the old pipes or face more costly inspections. In 2010, one of Enbridge's lines ruptured in Michigan and drew national attention. The EPA says more than 1 million gallons spilled into the Kalamazoo River.
Our past hasn't been perfect, but we learn from our mistakes, we learn from our incidents, and we are getting better.
A main concern for Native Americans who oppose the pipeline is treaty rights and the protection of wild rice lakes, like Mud Lake behind me. It's on the Leech Lake Reservation, and it's a popular source for the traditional wild rice harvest.
What they didn't understand is that we have gathering rights in the off-reservation ceded lands, and those rights are what were guaranteed by treaties that the Chippewa had starting in 1825, going all the way through 1902.
Joe Plummer is an attorney representing Red Lake and White Earth Nations. He says the state permit process has constantly shifted.
Well, there's state law and federal law that require the tribal cultural survey to be completed, and it hasn't been completed. I mean, that's objective. It has not been completed.
Attorney Frank Bebo says the fight over a new route for Line 3 goes beyond Enbridge and Minnesota. He says the outcome will set the stage for future pipeline proposals in the country.
If we can stop this first pipe, then we know we can stop the rest of them, because they have other pipes that are just as old as Line 3 that they also need to do the same things for, and they're going to want to expand.
Meanwhile, survey markers for a new Line 3 route dot the landscape. And while it's still months away from a final decision by the state, Enbridge's pipeline has already arrived. Paul Ebarth says there have been pipelines in northern Minnesota since the 1950s.
And we still enjoy, drinking clean water and enjoying the lakes in northern Minnesota. We can still replace Line 3 and continue to enjoy those natural resources.
If the state grants the permits this summer, Ebarth says construction would begin by the end of the year.
And the PUC is scheduled to make a final decision on the pipeline in July, but lawsuits could push back that date.
Lake Superior Community Theater is gearing up to make history. A groundbreaking production of August Wilson's Fences opens Tuesday in Duluth at the Lincoln Park Middle School. The show includes an all-black cast and a powerful family drama. Our colleagues with Making It Up North share this perspective from a recent rehearsal.
You're about 2 minutes into it, Rose.
So my name is Kyla Thompson. I play Rose Maxson, and this is Fences.
Fences is about an American family, a black American family, 1957 Pittsburgh. Blue collar, working class, no frills, and the everyday man issues they deal with, including the color of their skin.
No matter what kind of family background that you come from, there's always love to be given. There's always, no matter how much you quarrel with your brother or your sister, you're always going to love them. You're always going to have that support for them. And I think Rose in particular really shows that love, that unconditional love.
It starts out real funny. Yeah, that's August Wilson. And he just draws you in. And it gets more serious and serious. It's about husband-wife relationships, husband-son relationships, work relationships. It's a broad menu of issues, but blackness and the black American experience is right in the middle there.
This is the first all-black cast within the Northland, and it's about time. It's 2018, and this needs to continue happening. This shouldn't just be the start of it and then it never continues anymore.
I think a lot of the issues that you see in this play don't just happen to black families, but to all families, and I think if you can get your mind around that, you can get your mind around that we're all the same.
And this is just a story of a family that struggles like any other family, but this is a family of color that has never been kind of expressed in this way ever in Duluth and in the Northland. So I think it's so, so, so incredibly important that this is being showcased now.
Fences runs next Tuesday, March 27th through March 29th in Duluth, and then moves, stage, set and all, to Two Harbors and Silver Bay in the following weeks. Tickets are available online at lsct.us.
This evening at UMD's Tweed Museum, the Shades of Africa Festival is hosting Rise Up, honoring two civil rights leaders who changed the world. 5 Duluth leaders joined Judge Lejeune Thomas Lang, Minnesota's Honorary Consul for South Africa, in a presentation on civil rights and the quest for social justice. The festival marks the 50th anniversary of the assassination of Martin Luther King Jr., and Mayor Emily Larson made a proclamation naming July 18th as Nelson Mandela Day in Duluth.
Well, let's turn now to the business news from the editors at Business North. After a strong year for iron ore, the Port of Duluth-Superior reopened this shipping for the week now. For this new year, the Erie trader Clyde S. Vankenvoort was first out of the port on Tuesday, and today the 1,000-footer James R. Barker departed with a load of taconite pellets for the lower lakes. The Barker later, though, had to return under what a spokesperson said was an abundance of caution due to an engine-bearing warning light. And the K.E. Barker, a classic laker, headed out of port today, light, bound for Marquette, where she will load iron ore. In all, 5 bulk cargo freighters were expected to sail this week. The locks at Sault Ste. Marie will open at 12:01 a.m. Sunday. The Welland Canal and St. Lawrence Seaway, which connects the Great Lakes to the Atlantic Ocean, will reopen on March 29th.
Silvertip Graphics owners Barb and Corey Cleveland have opened the doors to a new venture in Grand Rapids called Custom Life Clothing. With a growing inventory, Custom Life offers sweatshirts, t-shirts, and other casual clothing customized with various designs and graphics. The new store hopes to envelop a name as a business that can take the stress out of fundraising with free online stores. They use a system that does not require paper forms, money collection, or inventory. Contributors simply place their order.
Duluth commercial printer ProPrint celebrated its 40th anniversary and the purchase of a new digital press on Tuesday. Owner Creston Dorothy said the press can apply polymers in multiple layers and can put colored foils on printed sheets. The company continues to succeed even though the overall printing industry has grown smaller as publishers move to the internet. The owner's philosophy is stand at the forefront without going over the edge. For more on these and other stories, visit businessnorth.com.
If you have a comment on our show, call now. Dial 218-788-2849 to leave a message or send an email to almanacnorth@wdse.org. And visit the WDSE website for our program schedule, updates on our local shows, and upcoming events here at the station. And Denny, it's good to see the ships out again on the big lake.
Wonderful sign of spring, is it not? Now I'm waiting to see my first robin. The ships are out, we need the birds.
The birds will be back, the gulls will be here soon enough.
I think so.
For Denny and the crew here at WDSE, I'm Julie Zenner. Have a great weekend. We'll see you next week.